over her body and that she has access to the medication she needs. That's fundamentally what this bill is about, in part. I'm sure we'll get an opportunity to talk about diabetes as well.
Questions and comments. Question commentaire. The Honourable Member for Saanich, Gulf Highlands.
Thank you, Mr. Speaker. This debate right now is on time allocation on C-64. And I just want to put to the Minister of Health that I would love us to be having a debate on an actual proposal for pharmacare. It's been since June 2019 that the former Ontario Health Minister, Dr. Eric Hoskins, gave this government and this country clear direction that we need a national pharmacare program. We're the only country in the world with a national health care program that does not automatically include provision of needed prescription drugs. And we know from the Hoskins report that properly implemented, a full national pharmacare program will save this country $5 billion a year at least. But picking two things out only, which is what's so strange about this bill and which is why I object to seeing debate closed before we can actually discuss it. Why are we only talking about reproductive health care and diabetes medication? Because what that may end up doing is give those opposed to pharmacare evidence that it costs more than it's worth, when we need to prove to everyone concerned national pharmacare will save our healthcare system money and ensure Canadians get the health care they need.
The Honourable Minister of Health.
Well, thank you very much, Mr. Speaker. And of course, this is a concrete proposal to move forward pharmacare in this country. The drugs are two classes of drugs. They represent more than 80 different medical drugs that are dealing specifically with diabetes and also with contraceptives. And it's part of a broader suite of actions that we're taking. For example, drugs for rare diseases, where I'm currently having conversations with every province and every territory about how we can take action on drug for rare diseases so that folks with rare diseases can get access to the medication that they need. It's part of what we've done on bulk purchasing to realize $300 million in savings for Canadians across the country. It also builds on the work that we're doing with the pilot and PEI, where we've been able to get co-pays down to $5 there, saving seniors hundreds and hundreds and hundreds of dollars in PEI. Look, action is taken one step at a time by demonstrating in evidence exactly what is going to be saved and exactly how this should function. As an example, in PEI, in British Columbia, when it comes to contraceptives, they're already showing that they're saving more than it costs them to run the program. I suspect that we'll also see that in diabetes. But Canadians rightfully want to see this in evidence. They want to actually see these things living out there, demonstrate how they work in each example, and then build on that successively. Our healthcare system was based on iterative process by making sure that the steps we take are prudent and smart and fiscally responsible, and that's the way that we need to proceed with pharmacare as well.
Questions and comments. Question